We are here doing an ultrasound at almost 32 weeks. I'm at the end of 31 weeks right now. I'm just really hoping that my placenta previa has resolved and baby girl is still head down. It looks like she's definitely head down, so that's very reassuring. And now I'm just waiting for news on whether I still have a placenta previa or if it's been resolved. She's moving around and her heart rate is really good. It looks like she's measuring 44th percentile and she's weighing a little tiny bit over 4 pounds already. It looks like they still might be seeing a previa, and so we're gonna do an internal exam to make sure there's nothing else going on and see if the previa is still there. Now they're looking at all the images and just making sure that they got all the images they need and verifying with the doctor. The ultrasound tech was saying that he sees something laying over my cervix, which definitely was not reassuring to me. And then when the report came back, it says that I still have a complete previa and a potential Vasa Previa. We're going to go into kind of what that means in a minute, but everything with baby looked amazing. She was 44th percentile. She had a great heart rate at 134 beats per minute. The estimated fetal weight was 1,829, which calculates to just over 4 pounds. I cannot believe I have a 4-pound baby in my belly right now. So the placenta has blood vessels that come through the umbilical cord, and they're covered by something called Wharton's jelly that protects the vessels and keeps them, when the baby bumps into them or you go into labor, it keeps them healthy and intact and protected. With Vasa Previa, somewhere either on the exterior of the placenta or within the cord or growing over the cervix, there's unprotected blood vessels. And so what can end up happening is that if the baby pushes down on them because you're going into labor and there's a lot of pressure or contractions or your bag of water breaks, any of those things can lead to those blood vessels bursting. And if they burst, that means that baby is going to massively hemorrhage and lose a lot of blood really, really fast. And babies don't have a lot of blood to lose. They have about the amount of blood that's in like a Coke can. And so if you do have Vasa Previa, then you want to be as close to a NICU as possible, because if that happens and you do go into labor or your water breaks, the baby can bleed out within like 5 minutes or less. When you have a complete placenta previa, you're going to have to get a C-section. So with that, they'll schedule a C-section between like 36 and 37 weeks of pregnancy. If you're having bleeding, they'll do it earlier. But with Vasa Previa, they're going to do a C-section a little bit earlier, sometimes as early as 34 weeks. They're really just trying to prevent you from going into labor because they don't want those blood vessels to rupture, and then it causes severe complications. And so because of that, they usually recommend that the mother gets hospitalized between 30 and 34 weeks of gestation and stays in the hospital to be monitored up until the point where she has a C-section. That way she's right there with the NICU in case anything is to happen. Pregnancies with resolved placenta previa or low-lying placenta are at higher risk for developing Vasa previa. Placenta previa usually resolves on its own, but a normal placenta is at least 2 centimeters or more away from the cervix, and you cannot have a vaginal delivery unless your placenta is at least 2 centimeters away from the cervix. If your placenta is covering the cervix, it's complete placenta previa, and if it's not, it's either like a low line or like a partial placenta previa. There's been instances in the past where Vasa previa was not caught and the patient delivered vaginally and ended up having a fetal hemorrhage, and the risk of the baby dying is really high if it's not caught before the woman goes into labor. But the cases that are caught have very good outcomes because they monitor it very closely and they ensure that the woman has a C-section and to prevent labor completely, so that does not happen. It says prenatal diagnosis of Vasa previa by ultrasound in the second trimester has a 20% chance of resolving. So I knew that I had a placenta previa. I knew that I had a complete placenta previa, and they had been telling me that there's like a 95% chance that it's going to resolve, but every time I went into my appointment, it was moving a little bit, but not moving as much as I needed it to in order for it to be resolved. And so knowing that I had a complete placenta previa and that it had not resolved, and I was 31 weeks pregnant, and then hearing the news that it might have turned into a Vasa Previa was like a little bit of a scare for me. And then I started doing tons and tons of research, like what is a Vasa Previa? What does it look like? Should I stop exercising? And I was able to get in to see my OB fairly quickly. So at this point, they were just going through all of the steps. The ultrasound indicated that I could potentially have a Vasa Previa. So at my 32-week appointment, they did another ultrasound, and she did not see anything indicating that I might have a Vasa Previa, which was extremely reassuring. So the first initial ultrasound indicated Vasa Previa, and then the ultrasound that she did in the OB office with measurements did not indicate a Vasa Previa. She did not see it. She wasn't able to see the Vasa Previa at all. So my OB put in a referral for a specialized ultrasound in order to get a second opinion and just make sure that there's nothing that we're missing here and that there's actually not a Vasa Previa there. I'm still waiting to do that ultrasound, and so in the meantime, I was just doing so much research, and what I was seeing is that the normal, or at least like the normal according to what I was researching, is that people were getting admitted to the hospital around like 32 weeks of pregnancy, staying in the hospital for a few weeks, sometimes longer. That way they were right there with close access to a NICU, so if anything were to happen, then they could just go back immediately for a C-section and prevent bleeding. And usually they were doing these C-sections at 35 weeks. So I will hear more. I was definitely reassured that my OB did not see a Vasa Previa, but just the fact that the first ultrasound report said that there was a Vasa Previa there makes me think that I definitely can't rule that out completely, and I am like excited and feel like I'm going to be so relieved to just have like a third ultrasound to make sure that that's not actually what's going on. Luckily, I haven't had any complications besides having a placenta previa. I haven't had any vaginal bleeding at all, and I have had contractions, but only lasting maybe like 10 minutes and then it goes away. But I will keep you guys updated on the outcome and if it is actually a Vasa previa or not. What I'm praying for is that my placenta previa resolves completely and it's at least 2 centimeters away from the cervix so that I can actually have a vaginal delivery and not be worried about bleeding or having a C-section. So stand by, and pretty soon I will let you guys know what they say about my placenta previa and whether it's a Vasa previa, and just give you guys all of the updates. I can't wait to find out.